Good afternoon, everyone. I'm Nirav Shah, the director of the Maine Center for Disease Control and Prevention. And I'm joined this afternoon by Governor Janet Mills and Commissioner Jeanne Lambrew from Maine's Department of Health and Human Services. Governor Mills, Commissioner Lambrew, and I are pleased to be able to join you today to provide everyone an update on where we stand with respect to COVID-19 across the state of Maine for today, Wednesday, January 13th, 2021. I'll start by providing a brief update on where we stand from a public health and epidemiological perspective, and then turn things over to Governor Mills. I begin, unfortunately, today on a sad note. In the past 24 hours, Maine CDC has received the reports of 4 additional individuals who have died with COVID-19. These 4 deaths include 2 residents of Penobscot County and 2 residents of York County. 3 of the people who died were women, and 1 was a man. 1 of them was someone in their 70s, and 3 of them were individuals in their 80s and over. Their passings bring the total number of individuals who have died in Maine associated with COVID-19 to now 453. We'd like to take a moment to express our deepest condolences to their families and loved ones during this very difficult time of grief. Right now, across the state, there have been a total of 31,150 cases of COVID-19, an increase of 824 cases since yesterday. Of those, 25,708 are confirmed and 5,442 are probable cases. Since we began our work on COVID-19 now, 1,201 people have been hospitalized. And right now in Maine, there are 207 people who are in the hospital, 64 of whom are in the critical care unit, and 23 of whom are on a ventilator. A brief comment on some of those numbers. Today marks the high point of 2 concerning numbers: the highest number of new daily cases, as well as the highest number of Maine people who are in the hospital. These come on a day when the nation recorded, at least yesterday, its highest number of deaths, more than 4,400 in a single day. This is a reminder that even though a vaccine has arrived, and even though we continue to vaccinate more people every day, we cannot let our guard down. Now, I know that's hard to do, especially because we've all had our guards up for so long. But the old-fashioned classics, wearing a mask, physically distancing, and avoiding crowds, are just as relevant today as they were at the start of the pandemic. Simply put, those actions save lives. I'd like to turn now to discuss some of the outbreak investigations that Maine CDC has opened since the last time we spoke. There are 6 in total that I'd like to comment on or note. 1 is at Maine Coast Senior Health Center, where we are aware of 6 total cases. Another is at the Coastal Shores Residential Care Facility in Brunswick, where we are aware of 5 cases. The third is at the Consigli Construction site at Maine Molecular, where we are aware of 11 cases. Another outbreak investigation we've opened is at Maine Coast Memorial Hospital in Ellsworth, with 6 cases. We've also opened investigations into 2 congregate living settings, one being the Cedars in Portland, where we are aware of 3 cases, and a new outbreak investigation at Winterberry Heights in Bangor, where we are aware also of 3 cases. Turning now to where we stand with respect to testing. Right now in Maine, the 7-day moving average for PCR tests conducted now stands at 5.35%. And the PCR testing volume now stands at 664 tests per 100,000 people in Maine. To put those numbers in perspective, 2 weeks ago, 1 incubation period ago, the positivity rate in Maine was 5.9%, and the testing volume was only 453 tests per every 100,000. Since then, the positivity rate has come down by 0.5 percentage point, and testing volume has rebounded just in that incubation period. Finally, a few notes on where we stand with respect to vaccinations. Cumulatively, there have been 62,004 vaccine doses administered across the state. Of those, 53,511 are first doses, and as of this morning, 8,493 Maine people had received both doses of their COVID-19 vaccine. With that, I would like to turn things over to Governor Mills.
Thank you, Dr. Shah. Sorry. Thank you, Dr. Shah. My fundamental goal, the goal of all of us throughout this pandemic, has been to save lives, very fundamentally. With the introduction of several vaccines last month, we received critical new tools in this effort, and we stood ready to use it, and we are using it. Maine has worked so hard to distribute the vaccines we've received quickly, efficiently, and equitably, and it shows. We've ranked very high among the states nationwide for the percentage of vaccine doses distributed. Just yesterday, Vice President Pence recognized Maine on our White House call as one of the leading states nationwide in rapid distribution of the vaccine, and he asked me to share with the group, with the other governors, best practices on our call. To date, 53,511 people in Maine have gotten first doses, as Dr. Shah mentioned, with 62,004 doses provided in total. Excluding the doses provided to the retail pharmacy long-term care program administered by the federal government directly, 82% of the first doses of vaccines Maine has received have been administered as shots in arms. That's overcome to vaccinate all eligible people, all 1.3 million people, hopefully, in the state of Maine. Chief among our challenges is the fact that Maine is receiving a limited, unpredictable, and inconsistent number of doses from the federal government. This week, we received only 100 doses more than last week and less than what we got at the end of December. Based on that limited supply, in the first phase, or phase 1A of vaccine distributions in Maine, we focused on protecting the healthcare personnel, including doctors, nurses, EMTs, CNAs, who are working to save lives during this pandemic, and the staff and residents of long-term care facilities who've been hit pretty hard by this virus. It's like when you're on an airplane and you're responsible for someone else. You get on the plane and they tell you, put your mask on first so you can then take care of others. That's why frontline healthcare workers are universally in phase 1A of vaccination distribution. I strongly encourage everyone who's eligible right now, especially the staff of long-term care facilities, get vaccinated as soon as possible. It's safe, it's effective, and it will save the lives of people most at risk of being sickened or dying from this virus. The same people who rely on you every day for their own care. If you have any questions at all, I encourage you to speak with your doctor who can help provide you information about the vaccines. Or go online on our website. But most importantly, it's important not just to protect you, but to protect the people you're caring from. And eventually allow those facilities to open up to visitations for the people who are so desperate to see their loved ones. Today, we're expanding phase 1A to include other first responders and public safety personnel, firefighters, police, other law enforcement officials, and corrections officials to ensure the continuity of basic public safety services for Maine people. We're also expanding phase 1A to include certain personnel who are critical to Maine or the nation's COVID-19 response, pretty fundamental. Those people at IDEX Labs, Abbott Labs, Puritan Medical, Maine CDC, Jackson Labs, the people who are responsible right now for manufacturing, testing, distribution, processing, and reporting of COVID-19 tests, and whose work, if disrupted, would severely hamper our ability as a state and as a nation to respond to this pandemic. Collectively, these actions further protect and ensure the continuity of emergency response services and COVID-19 response infrastructure on which people rely. If the supply of vaccines from the federal government continues at its current pace, we expect to complete phase 1A by the beginning of February. In planning for future phases of vaccine distribution from Maine over the past several weeks, closely reviewing the recommendations of the United States CDC Advisory Committee on Immunization Practices, ACIP, and I've been discussing those recommendations with public health officials across the state to understand their applicability for our state. In light of Maine's unique challenges in combating the COVID-19 pandemic, we have been considering in recent weeks changing the vaccination distribution plan to target the next phase, phase 1B, first to older Maine people and those with serious underlying conditions. The object is very simply to save as many lives as possible. We keep asking ourselves, who is it who is likely to suffer and die if they don't get the vaccine? Yesterday, the United States Department of Health and Human Services seemed to agree with our thinking, and they updated their recommendations to states to encourage them to prioritize vaccinations for older people and those with high-risk medical conditions. I'm encouraged by these recommendations and that they align with our goals of first vaccinating people who are most at risk of suffering and dying from the deadly virus. However, we do have some questions about how this change will affect the state of Maine. While we await more details on those recommendations, including how changes to the vaccine allocation formula and distribution of second doses of the vaccine will work for our state, we will move ahead with the changes we've been considering to our own vaccination distribution plan. So today we're updating phase 1B to include older Maine people, beginning with those who are 70 and older and adults with high-risk medical conditions. And we hope to move into phase 1B this month. Again, depending on supply, as always. We're making this change because we know that Maine has a larger proportion of older people and people with underlying health conditions, serious conditions, than other states do. We also know that COVID-19 poses a greater risk of serious illness or death to older people and to those with underlying health conditions. More than 85% of COVID-19 related deaths in our state have been among people 70 years of age and older. More than 85%. And 17% of Maine people 70 and older have been hospitalized for COVID-19, compared to less than 1% of all people of a younger age. So this change will help protect those who are most at risk of suffering and dying with COVID-19. Let me be real clear. If you're 70 years of age or older, please don't go rushing to your doctor's office when you hear this news. They're not ready to vaccinate you yet. Additional information on vaccination for people age 70 and older in Maine will be available the week of January 18th. Not too far off. For now, please continue to be patient and take every precaution, as I know most of you have been doing. We're starting with Maine people 70 and older instead of 65 and older right now because we simply don't have enough vaccine and because the risk to their health and lives is so great. Once we've finished vaccinating the approximately 193,000 people in Maine who are 70 and older, and people with underlying serious conditions, or if we receive a great deal more vaccine than we're expecting, we will move next to vaccinate people between the ages of 65 and 69. After we vaccinate people of ages 65 to 69 and other people with pre-existing conditions that put them at serious risk, we will move to vaccinate frontline high-risk workers, those who are at most risk of contracting or spreading the virus. As information about our supply of the vaccine becomes available under the new administration in Washington, we can and will make more informed decisions and determinations about who those individuals are and when they can be vaccinated. I know this is a bit disappointing to some people in Maine who will have to wait a bit longer to be vaccinated based on the lack of supply. But I firmly believe that every person in Maine is essential, whatever they may do for work, wherever they may live, whatever their family situation. Right now, with our limited supply of vaccines, we just have to focus on saving as many lives as possible. As more vaccines become available in the state of Maine, we will focus next on protecting those who are at risk of contracting or spreading the virus, those most exposed. Depending again on the supply of vaccines, we're aiming to complete phase 1B, hopefully by April. Phase 1C will include the other high-risk frontline workers described in the ACIP designations. And phase 2 will include people ages 16 to 64 who are not otherwise eligible. Eventually, everyone in the state of Maine who's eligible will be vaccinated. It's just a matter of time. The phases for those latter categories are planned for the spring and summer. So to summarize, based on our current expectations of supply, as of today, phase 1A, in addition to healthcare personnel such as doctors, nurses, other healthcare professionals, EMTs, and staff and employees at long-term care facilities, that now includes firefighters, police and law enforcement, corrections officers, and critical COVID-19 response personnel. And we expect to complete phase 1A based on current supply at the beginning of February. Phase 1B now will include older Maine people, beginning with Maine people 70 and older, and people with underlying serious health conditions. And it still includes people age 65 and over, and frontline workers at most risk of contracting the virus. Depending on how many people are determined to be those high-risk frontline workers, we expect to complete phase 1B by April. After phase 1B is completed by spring or summer, we expect to begin vaccinating everyone else in Maine. Please be patient and take every precaution you can still. It's so important. You heard the numbers today. Our hospitals are getting full again. ICUs are getting full. Staff are getting overwhelmed. We can't keep on that path. It's up to every one of you to keep your guard up, take every precaution, as Dr. Shah, Dr. Fauci, and so many others have been advising for months. We can't let down our guard. This process, by its nature, is confusing and complicated. I wish more than anything I could give every person in Maine a simple date on the calendar, a ticket, and a reservation to get the vaccine on a particular time, particular date. But we can't do that. These changes come only after consulting with the Maine Immunization Program, Maine Healthcare Association, Maine Medical Association, the healthcare systems who've been so cooperative across the state, and the Primary Care Association. And after hearing from hundreds and hundreds of individuals and interest groups representing different individuals who are advocating for various sectors of the population, and I appreciate all those arguments, each and every one. They are valid, they are very valid. But as always, our decisions have to be based on science, fact, medical expertise, and that's why we're doing what we're doing today. Our administration will continue to update you with more detailed information as we receive it from the federal government and as we adjust the plan in the weeks and months to come. In the meantime, if you've been vaccinated once or twice, or if you're waiting to be vaccinated, please just keep taking the steps that we know keep us safe wherever you work, wherever you live, whatever you do in life. Wear your mask, wash your hands, watch your distance, and avoid gatherings. Please avoid gatherings, as tempting as they are. We're almost at the point of being able to vaccinate the people who are most likely to get seriously sick or die from this virus. You can do your part in the meantime to protect them by taking these simple measures and being extraordinarily patient. Thank you, and I'm happy to discuss and answer any questions, along with, I think, Dr. Shah and Commissioner Lambrew, who's also on the conference. Thank you.
Thank you very much, Governor Mills. We will start the questions off this afternoon by turning to Patrick Whittle.
Thank you very much, and thank you for the very comprehensive look at the immunization plan. Two things. You largely detailed this already, but this plan of focusing on older residents, emergency service personnel, people with high-risk medical conditions, this seems pretty similar to what the plan was already. So if there are there any significant departures here that we should be highlighting? Because this seems more like a tweak than an overhaul, I guess, is what I'm trying to say.
Well, we had not made any decisions regarding 1B or expanding 1A prior to now. There were a lot of recommendations contained within the ACIP report and what the US CDC has been doing, and they just changed what their recommendations were yesterday. And this comes after reviewing the rather expansive categories contained in the ACIP recommendations, which is just too expansive for us to complete in the near future right now, given the supply. And discussions with the White House Task Force on COVID-19 prevention and mitigation.
I see. Also, in the coming days, in the coming week, there's a possibility of there being demonstrations at state houses around the country. Could you speak to the possibility of these events possibly serving as venues to spread the virus?
Serving as what? I'm sorry, Patrick?
Serving as venues that could spread the virus.
Any congregation of people, any grouping of people, gathering of people can serve as potentially a super spreader event, potentially. I would not want to be responsible for such an event. I hope people take their personal responsibility, their moral responsibility, their responsibility to the other people of the state very, very seriously and contemplate their actions before joining any gatherings of any sort, whatever the politics, whatever the message, whatever the reason.
Okay, thank you very much.
Thanks, Patrick. I'm going to turn it over to Don Kerrigan next.
Good afternoon, Dr. Shah and Governor. Question about our capacity. Two questions. One about the capacity to increase the vaccinations. Do you have a plan in place yet as the U.S. Health and Human Services Secretary said yesterday, to move vaccinations out beyond the hospitals, to really get them out into the community, into clinics, to truly reach out to all these, 190,000 people over age 70, something like that? Do you have a plan yet for how to do that? Who's going to do it?
We have discussions, not a concrete plan to share with you today, but been having discussions along those lines for some time. What I told the Vice President and Secretary Azar on the phone yesterday was, because they discussed, quote, increasing the pace, us increasing the pace as states and them increasing the pace of supply. And I said, if you build it, they will come. If you send it, we will use it as soon as possible. Whatever you send, we will use.
And I will add, just as a narrow point though, for those people over age 70 and over who will soon be able to be vaccinated, we ask them to not yet call your doctor. We are going to, starting the week of January 18th, put on the Maine vaccine website information about how people can reach out to their doctor, their health system, wherever else they get healthcare. So we will be providing information beginning next week on where people can go when they are 70 and older and are looking for a vaccine.
So so are you saying that you will have that plan in place by sometime next week?
So we will have more information in place, and the plan itself is evolving, as the governor said. We have begun with hospitals, some of our large outpatient provider sites in the state of Maine, like Martin's Point and Intermed, have been providing vaccine. They've opened their doors to community-based providers, those physicians who are solo practices who are too small to get 100 doses of vaccine themselves to be administering. So we've already begun the process of moving out from hospitals. Our federally qualified health centers have been sites for vaccination as well. We will begin to expand that circle beginning next week with the healthcare providers that our older Mainers go to anyway. But that work will continue over time as we build towards all those additional groups that the governor mentioned.
And if I could ask one question of Dr. Shah, regarding the vaccination of people in nursing homes and assisted living facilities being done by those large pharmacies. You've sounded fairly critical of that. Can you give us an update on those numbers? And if the pace of those vaccinations continues to be slow, as it appears to have been so far, is that a sign that it's going to be hard to reach out to these much larger numbers of people?
Sure thing, Don. I'm happy to provide that update. Let me start by noting that, again, these numbers that I'm going to walk through right now are perhaps a couple of days, perhaps up to 72 hours behind. And that is because the pharmacies themselves have 72 hours to report their latest progress to us, as opposed to every other provider in the state of Maine, which must do so every 24 hours. So let me start by noting that at the top. As of the latest data that we have, there have been a total of 8,645 staff members and residents of long-term care facilities who have been vaccinated by CVS and Walgreens as part of this federally operated partnership between CVS and Walgreens and the US CDC and the sites themselves. The breakdown of that is roughly about 6,600 among skilled nursing residents and staff members, and about 1,800 or so among assisted living. That's because the skilled nursing was the Part A that was activated first, and the assisted living constituted Part B, which was activated second. Last week, about a week ago, that number, the 8,645, stood at 4,034. So they have vaccinated about 4,300 people over the past 7 days. That's an uptick. That's better. That's an acceleration. I want to see that pace continuing. I don't want to see. I'm going to turn now over to Courtney at WGME.
Hey guys, can you hear me?
Yep.
Awesome. Well, my first question is, I know you guys talked about the number of vaccines that you already administered, and there was a much smaller number of residents who received the second dose. Do you guys plan before moving into the second phase of vaccinations? Do you plan to administer second doses to those residents who haven't received them yet, or is that up to the resident who is taking the vaccine?
Governor, I can jump in on this one if that's all right. Courtney, there's your question sort of presupposes that we must finish everyone who has received a first dose and ensure that they have received their second dose before we can vaccinate a new batch of folks with their first and then subsequently second doses. But what we found in practice is that that's not the case. Clinics are able, whether they be in hospitals or as part of this retail pharmacy partnership, are able to simultaneously give folks their second doses while they are vaccinating new folks with their first doses. Again, it goes back to how we've talked about this. We are turning up one dial while we're turning down another. We're turning up the dial on new folks getting their first doses while rounding out those who need to get their second doses. We don't need to complete everyone's series of 2 doses before we start with the new batch. We can do them at the same time.
Absolutely. I did have another question. In other states, we have become aware of hospitals and frontline workers who are getting vaccinated. They have some employees who are turning down the vaccination, and the dose of vaccination is then being thrown away. Can you describe to us what it looks like in this situation in Maine? Are you guys, if someone is to turn down their dose of vaccination, do you use it as supply for another person, or is it being tossed out as well?
Go ahead, Governor.
We're not tossing out any vaccines, period.
Perfect.
That speaks for itself. That's exactly right. We've instructed hospitals that the prime directive here is not a single dose goes to waste. We've received outreach from certain hospitals who have said, we have 2 doses left in this vial of Moderna. Do you know anybody in the community that can use it? And we've been able to find them frontline healthcare providers to recruit and go in quick notice to use up those doses. And we've been doing that. We'll continue doing that. No dose is going to waste.
Absolutely fine. Awesome. And my final question, are you guys planning on any mass vaccine locations as you start rolling out new phases with, the older citizens in our state, or is there going to be just more information on where people can go find a vaccine?
Probably some of both, depending on where people live. There may be congregate areas where people of a certain age live in large numbers, where it might be easier to vaccinate them in place, or bring them to a place where there's space available so that people can keep their eyes on them 15, 20 minutes after getting the vaccine and get the proper paperwork done. There's a little process, it takes a few minutes, but you also need space and sort of volume, and we'll get it done. Maybe some of each.
Absolutely. Thank you, Governor Mills.
I'm going to turn it over to Evan next. Evan Pop.
Hi, Dr. Shah. Thank you. Governor, a question on the updated phases. You said that the expansion of phase 1A would include correctional officers, and I'm wondering, will it also include those incarcerated in prisons and jails? And if not, what phase would they be in?
I think they would go into the general phases following phase 1A, 1B, et cetera. Corrections officers, vaccinating them serves a double purpose. It protects them and their families, and it protects the people in their care, the residents of these facilities. So we think it's first and foremost important to vaccinate the staff. Inmates, residents will come at a later time, undetermined.
And just a related follow-up question to that, the expansion that you're talking about in 1B to older Mainers who are over 70 and those with underlying health conditions, will incarcerated people who fit into those specific categories be included in that phase as well?
They may. It's difficult. The problem is that it's people 70 and above, we expect to have at a particular place with appointments set up so that we can vaccinate great numbers of them at one time. If there are 2 or 3 inmates in a particular facility who happen to be over 70, that's not going to be as feasible from a logistical point of view. But our priority are people of that age group, wherever they are.
So is that still to be determined? Is that a good way to put it? Or you're, I'm just kind of...
They're not excluded, they're not specifically included.
Okay.
We don't have a facility just for people 70 and above who are incarcerated. We don't have that kind of concentrated population. Whereas we do have concentrations of populations of people 70 and above in the general population. Makes it a lot easier to vaccinate them.
Okay. And just one last question, if I may. About the budget that you just released recently.
Budget, yes.
Can you talk a little bit about the decision to prioritize adding funds to the rainy day fund instead of additional spending on healthcare and the economic response to the pandemic? One might argue that the moment we're in constitutes a rainy day. So I'm just kind of wondering what the thought process was behind that.
Well, first of all, the pandemic is enduring. The pandemic is not over, not by a long shot. Would that it were, but it's not. We're still in a state of emergency. We expect it to continue based on public health data, the best scientific information we have. And you heard the statistics just now, yesterday. We had the highest number of deaths of people with COVID-19 ever in the United States. Yes, that's an emergency, but it's continuing. We have to be prepared for that exigency. We're not avoiding spending on public health. In the budget, the same budget document, we are prioritizing continuing to rebuild the public health infrastructure that suffered for so long in previous years. We are rebuilding that, and we are focusing on CDC and child welfare and public health nursing and the like, and education and broadband, all somewhat related to the same emergency. So we're not ignoring those same issues in the same budget. I will note on the call yesterday, it was mentioned that there's another $3 billion coming down the pipe from the federal government at some point. I asked about it and didn't receive a satisfactory response. $3 billion for COVID vaccine distribution and COVID-19 response. I'm not sure what we'll be able to put that towards, how we'll be able to use it, but I'm excited that there will be more funds coming down the pike for us to vaccinate more people more quickly and save lives.
Thank you, Governor.
I'm going to turn next to Patty White over at Maine Public.
Thanks, Dr. Shah. Are you getting any more clarity on the future supply of doses? And what's your reaction to the Trump administration saying that they're no longer going to hold the second doses in reserve? When you talked about that last week, when the idea was floated by the incoming Biden administration, you said there would be potentially logistical challenges and not necessarily the most helpful thing.
Let me start by noting one important thing, Patty, which is notwithstanding Secretary Azar's announcement yesterday that no doses would be held back in second dose reserve, that has not yet happened. This upcoming week's allocation for the week that starts this upcoming Monday is only about 1,300 doses more than we got this week. And as Governor Mills said, this week we only got 100 doses more than we got last week. We were getting more doses of vaccine at the end of December than we are now. And so while we have been discussing amongst other states and internally what the implications of this holdback or now non-holdback would be, we want to see exactly when it's going to happen and what the increased volume looks like. As of right now, it hasn't started happening. It would present some challenges for us to make sure that we on our end could account for those second doses. Right now, that accounting is being done by Operation Warp Speed. We would have to do so on our end, but given the imperative to get shots into arms, we're ready to go if and when they move in that direction.
And on our call yesterday, I will just add that Secretary Azar mentioned that this wouldn't begin till 2 weeks at the earliest, which interestingly puts that on the next administration in Washington. But there's also discussion about Johnson & Johnson going through trials for another vaccine that might be more scalable, that will be a one-dose vaccine. To the extent that happens in the coming month or two, that would be a real boon to this effort and provide hopefully a lot more production.
Thanks. And in terms of the people who are now included in 1B, Governor Mills, I think you said that's about 193,000 people who are 70 and older. Is that separate from the people with high-risk medical conditions? How many people do you think that might be? And can you give us some indication of what kinds of medical conditions you're talking about?
Good question, and it is pretty difficult to designate that. The 193,000, for example, does not include those who are in long-term care facilities who should be getting vaccinated now, and whose families I encourage to get the informed consent forms reviewed and signed whenever appropriate. But so that's a higher number than the actual number who will ultimately be vaccinated under the 1B designation. Identifying who has the kinds of high-risk medical conditions that put them at higher risk of suffering and dying with COVID-19 is not an easy task. I'm not a medical practitioner. I'm not going to sit here and say those with diabetes and high blood pressure, those with stage 3 cancer but not stage 2. That is not for me to say. But we are going to be convening people to discuss exactly that and trying to figure out the numbers of people in Maine who would be most at risk. It won't necessarily be everybody with asthma potentially. The great numbers of people with asthma in Maine. It won't necessarily be everybody with some form of diabetes, but it may be those who, along with their practitioners and medical experts, feel, based on statistics from the last 10 months and based on medical knowledge, are at much higher risk of suffering and dying with COVID than other members of the population of Maine.
Thank you.
We can't be arbitrary about it. We've got to be scientific.
I'm going to turn now to Eric Russell at the Press Herald.
Thank you, Dr. Shah. I have two questions. The first one is sort of a clarifying question. So now that we've better identified Group 1B, there are clearly some tiers within Group 1B. Now we've got 70 and older, and we've also got some essential workers like teachers and I assume grocery store employees and things like that. along with other essential employees who are at great risk of contracting the virus. How do you make decisions within those tiers? By that, I mean, are 70 and older going to be the first in line and then you get all them done and then move on to essentials, or is it all happening at the same time?
Well, let me begin the response by saying I very much dislike the term essential workers or essential anything. There is nobody in Maine who is not essential in my book. Nobody who's not essential. It's a term that began to be used by ACIP at one point, and I dislike it. Determining which groups of people are better able to get the vaccine, better able to reduce the spread of the virus by getting vaccinated, at higher risk of contracting the virus and or spreading the virus, depends on a great number of things. We haven't made those determinations. We haven't drawn those lines yet. We're trying to get through the highest risk people first and foremost. We've gotten a lot of communications from groups of people because they represent people who are exposed to the public or people who are vital to the cogs of commerce turning or vital to a particular industry continuing, vital to the economy. There are a lot of arguments to be made on behalf of every one of those identified sectors and described in the ACIP 1B. We haven't made those determinations or drawn those lines at this point because we want to first and foremost save as many lives as possible, reduce suffering, and look at the most vulnerable people in Maine first and foremost.
Okay, thank you. And the other question I had has to do a little bit with the pharmacy program for long-term care residents and staff. Can you give a better sense, Dr. Shah or Commissioner Lambrew, perhaps, about why there's been such challenges of getting these things, getting people vaccinated quicker? Are there specific problems that are holding these things up? And more specifically, has there been a staffing problem with Walgreens, which is something that we've heard?
I can start, and then Commissioner, Eric, I think there have been a few things, but I would zero in on what you noted, which is in particular with Walgreens. We have urged them to ensure that they have the requisite number of staff ready to go before they get on site, that they've fully mapped out what their plan of operations is going to be so that when they get on site, they can move quickly. So I think as with respect to Walgreens, that has been a challenge. Our message to both CVS and Walgreens has been pretty clear. We want all gas, no brakes. Glad that in the past week they have increased volume. Again, as I mentioned to Don, I want to see that going. I will say on the other side is having moved through a certain percentage of the larger skilled nursing facilities, the program now shifts to smaller facilities like assisted living. And those are smaller, they can be a little bit harder to schedule, they can be harder to slot in on different days. So I think we're seeing a little bit of both, but I'm hoping that now that what I'm hoping were first day, first week growing pains on the part of CVS and Walgreens have been worked out, we'll continue to see acceleration.
And I'll only add that we are working with independent pharmacies as well and directly working with them, and that appears to be going well. And as needed, if we do find ourselves continuing to have these kind of gaps, we do have our public health nurses who are capable and able to help vaccinate vulnerable populations. So we are considering a plan B as needed.
Oh, quick follow-up now that you mentioned that, Commissioner Lambrew. I know that some other states effectively opted out of the federal partnership with CVS and Walgreens. I'm thinking of West Virginia particularly, that is not doing that and has had a lot of success in kind of doing its own thing to get those residents and staff vaccinated pretty quickly. Was that ever on the table in Maine, or could it be on the table now?
It is on the table now as we begin to look at this program to see what alternatives we have, because as the governor has said, our goal is to save lives. And we do know that residents of long-term care in Maine have been especially hard hit by COVID-19. Going back several months ago, I mean, we thought that the program looked promising. We took the option like the vast majority of states. I still think that there are some pockets of success in the program. I'm not going to discount the fact that the 2 retail pharmacy chains are working hard to try to make this work and have vaccinated some people, as Dr. Shah said. All that said, our job is to ensure residents of Maine who are vulnerable get vaccinated. So we are looking at our options.
Eric, I want to add on just two things. One is, as you noted, we did not see them as mutually exclusive, right? So we have and are using now public health nurses from Maine CDC to go on site to facilities to do the exact same thing that Walgreens and CVS are doing. We are also utilizing independent pharmacies in Maine, not CVS and Walgreens, but local Maine-based pharmacies to do that exact same thing. We saw that, we thought that as we've taken the same approach elsewhere in the pandemic, all the options working in tandem was the better approach rather than just relying on one stream. And we're now spinning up all of those other ones. That's one reason we're hopeful that the numbers will continue to go up. The other point I wanted to make, this is just a clarification for everyone on top of something I said on Monday, which is on Monday, I decided to take 1,950 doses from Walgreens and move it to a hospital. I want to be very clear and emphasize that in doing so, we did not delay or push off any clinics that Walgreens had slated. Walgreens was unable to tell us when those doses would be put into arms. Indeed, made it clear that they did not have an immediate plan in the forthcoming 7 days or 12 days to do so. So there was no jeopardy by moving it to a hospital that could use it right now this week. We've received some questions about whether that decision could have contributed to any delays, and I want to be very clear that it did not.
Thank you all.
I'm going to turn over to Amy Brown next. Amy?
Sorry about that. Can you hear me now?
Yeah, go ahead, Amy.
Okay. I want to, thank you. I want to continue with the questions about the tiers, and then I have something completely different. But are you saying that 1B will start while 1A is still underway? And then in terms of 1B, there are sort of the two different tiers as referenced earlier. Will they be sequential? So those who are age 65 to 70 and or with risky medical conditions will not receive vaccinations in 1B until those 70 or older have been completed?
I think we envision a phased-in approach. If somebody who's 71 appears at a clinic to be vaccinated and they bring their spouse who's 69 and 10 months old, they probably won't turn that spouse away because it's efficient and medically appropriate for them both to get vaccinated. So it'll be a bit of a phase-in approach.
Okay. And 1B can start while 1A is still underway?
To the extent that vaccine doses are available, absolutely.
Great, thank you. Now for something completely different. We heard from someone who tested positive for COVID at the end of November and has recovered, and they're asking if they need to do the 10-day quarantine when they return to the state, and if there's any reason, if they travel, and if there's any reason for them to do that before they return to work, even if the state doesn't require it.
So, Amy, this is someone who had confirmed COVID and has now been deemed to be recovered after their 10 days.
Right.
Right. So individuals who have had COVID and have recovered do not need to take special precautions. They are considered to be those who will not transmit it to others. And so they are, as an epidemiological matter, their risk of carrying COVID or transmitting it to others is not something it's not been proven that they can transmit COVID to others.
Great, thank you.
I am going to turn over to Dustin next.
Thanks, Dr. Shah. This is for either you or the governor. What is the message for the people who've been moved down the list who have to wait longer than what was originally outlined to get these folks 70 and over, and then those folks 65 and older vaccinated?
You're on the list. Everybody's on the list. That's clear. We are constrained by limited supply at this time. And the question we keep asking ourselves is, who is it who is most likely to suffer and die if they contract the virus? The answer to that question, both at the national level and here in the state of Maine right now, is those who are older and those with serious underlying conditions that make them more vulnerable. no matter what their place of work is, where they live, what they do for pastime or for occupation. Those who are of a certain age, you heard the statistics earlier, 10% of the people who contract the virus over this age of 7, who are 70 or over, have died, 10%, whereas less than 1%, I think it is, for people under 65 or so. So looking at those tragic statistics, it's pretty clear, and it's consistent with what the federal government is saying now as well, that we have to protect the most vulnerable first and foremost. Nobody's off the list. There's no registration system now based on your occupation or your preference or what you do for work at all. Everybody will be vaccinated. Everybody who's eligible, who wants a vaccination will be vaccinated, hopefully in the coming months. Again, depending on whether the Johnson & Johnson vaccination is approved, given an EUA, whether or not there's an increase in production by Pfizer and Moderna, an increase in transportation and delivery from the federal government to the state of Maine.
And then what did the vice president specifically ask regarding Maine's vaccine administration on that call you were part of? And could you give us a little bit more detail on his response?
Sure. Well, and let me back up and say the message to people who are not right now in 1B is we value your life and your health as well. We value the life and health of everybody in this state, and you are essential, and you will be vaccinated whenever, the soonest time we can do it. The message yesterday on the phone, I was called upon to describe what Maine had done that put us in a better spot than most other states. And I talked about how we had collaborated early on, back in August, when there was only a rumor of vaccines, honestly. These 2 vaccines which came to us, which came into being in December, were just in phase 3 trials and had not been validated, had not received emergency use authorization. But when we even heard a rumor about vaccines, we started collaborating and talking with all of our health partners, the nursing homes and long-term care facilities, the public health nurses, the Maine immunization program, the Maine hospitals, major healthcare facilities and systems, to see how we could get this done when it comes to us as soon and quickly as possible. Because we've done that, even though we have the most dispersed population in America of any state in the country, even though we're a much older state than others, we are still doing a much better job than most states in testing and treating and getting people vaccinated. Our numbers are still relatively low in terms of cases and other important counts, and relatively high in vaccinations because we started early and we involved everybody who we thought might become involved in a vaccination distribution process. And they've been so helpful. People have volunteered, people have come out of retirement and out of schools and elsewhere to help with the vaccination program, because they know universally it is so important.
I'm going to turn it over to Allison Ross next.
Hi, good afternoon, Dr. Shah. Thanks so much for taking my question. This is more of a clarification question for Governor Mills. So, Governor, Operation Warp Speed announced that their intent to change the allocations is based on the percent of vaccine that a state has used. So since we have been deemed one of the top states for really getting out this vaccine and putting it into people's arms, would that mean that we would actually be receiving more vaccines than, say, some of the other states that aren't doing as well?
We hope so, and I received some confirmation and confidence along those lines yesterday on the call, but with no specifics. I think I asked specifically, do you mean the pace of getting into arms of people 65 and over, or getting into arms of anybody and everybody? And they said the aggregate, everybody. And our pace is pretty good compared to most states. And they also said it'd be based on the population of older citizens too. We've got that as well, since we have, frankly, the highest proportion of older people in our state of just about any other state. But there were no numbers associated with that. So, in fact, we're getting 18,000 change next week. Not a significant increase yet.
Okay, and then kind of just going off of that, so we have been named one of the top states for vaccinating. Not to name any other states, but what are some of these other states doing incorrectly?
Incorrectly? I can't say. I mean, I'm not going to judge what 49 other states are doing correctly or incorrectly. Not for me to say. They gave a lot of positive recommendations about our state and a couple other states, but they weren't being critical specifically of other. They didn't single out other states for not being as successful, relatively speaking.
Great, thank you.
Thanks, Allison. I'm going to go over to Caitlin Andrews next.
Good afternoon, Dr. Governor, Commissioner. My first question, I guess, would be towards the Commissioner. Can you talk a little bit more about the kind of information that's going to be released on January 18th? Is this going to be like guidelines for providers or like a list of numbers for people to call, things like that?
We have a website at maine.gov. We have our COVID-19 vaccines website that we urge people to go to. It is for the Maine public. And on it, it has a new section that talks about when can I get vaccinated and where can I get vaccinated. What we're hoping to do, and this is the early phases, we will, beginning next week, put contact information, websites of Maine healthcare providers that are willing and able to begin to vaccinate older Mainers. We also know that many of our primary care doctors themselves, when they're part of the system, will reach out to people. So on our website, the COVID-19/vaccines at maine.gov, we will begin to put that information. We hope over time we could create more opportunities to use our website to connect to sites that have spaces for vaccination, but it's early on in the process. Just for now, though, we do ask people, hold off. We're all getting organized, so when we begin to vaccinate older Mainers, we're doing so in an orderly, safe way. But beginning next week, that information will be available, and some of our healthcare providers will begin to schedule people soon.
And I think Dr. Shah has pointed this out before, but logistically, some of the hurdles you already know about are the fact that the Pfizer needs to be held in ultra cold temperatures, ultra cold freezers. That's been addressed. We got prepared for that last fall, and they come in cases or packets of certain numbers of doses. And I think once you open the cases of 975 doses of Pfizer, for instance, plus some buffer perhaps, 100 doses of the Moderna, you can't let it sit around for days. So you got to have people ready to be vaccinated, have appointments made up front and use it all up as soon as you can. It doesn't sit around in the refrigerator for days on end once it's reconstituted, ready to go.
Thank you.
It also can't be used immediately. It also has to thaw. So the second you open up the package, you have to let it thaw to get up to room temperature so it can be mixed. And so it's a process, which again means that everything has to be thought out in advance so people don't show up, congregate, and still have to wait hours to get vaccinated.
And in other words, you can't just go to your local doctor and say, I'd like a vaccine, and you're the only one who shows up. I mean, it has to be organized, systemized, grouped like that.
Thank you. And my second question is about, I guess, kind of like the potential for more vaccines to be out. And I know, Dr. Shah, you've talked about getting community sites once like the vaccines start going out broader to the general public, and have said that those are still kind of in process. But how does this potential plan from the White House to release more vaccines affect that search? And, have you guys considered using these stand-up hospital sites that Maine has never really had a reason to use for that purpose?
Sure, Governor, I can start if you wish. So the answer, Caitlin, is that the potential to have more doses coming into the state, if or when that happens, these second doses that were previously held in reserve, which now might be pushed to states to be used as first doses, that intensifies our desire to get these community level vaccination sites stood up, large scale, high throughput, open, so that as we are expanding now, as the governor outlined earlier, into groups that are quite large, we can start moving through that as quickly as possible. And we haven't seen yet what that expanded throughput to states might look like, but we are thinking and recognizing that it may be coming soon. Secretary Azar signaled perhaps 2 more weeks from now. We are, again, intensifying our approach to stand these sites up. With specific regard to the question you raised, Caitlin, about utilizing the sites, these alternative care sites, that's something that's under consideration. We have to do so carefully because we don't want to crowd out or obviate the potential for those sites to be used as alternative care sites if the need arises. So that planning is occurring in parallel. We don't want to foreclose one option for the ACSs because of the need to vaccinate people as well. As you can see there, that's a delicate balance.
Thank you. And if I could do one more quick, I know you've talked about the, I guess the qualifications you're looking for these community sites, but can you talk a little bit more about like the process, the nuts and bolts of trying to find a place where this could happen?
I'll talk about it very generally. What we've done is convened a group within Maine, at the state level of Maine CDC, DHHS, Maine Emergency Management, and a number of other groups who are knowledgeable about what assets there are in place. We've started by looking at sites where the state of Maine already has what's called a POD agreement, POD being a point of dispensation or dispensing. As part of our standard public health emergency preparedness, for years now, we have already had and maintained agreements with locations across the state in the event that they were needed. So we started with those locations where we had a pre-existing arrangement in place, reviewed those arrangements as well as those sites for their suitability. Some were better than others. Some, for example, did not have enough parking. Some were not ADA accessible. Some may be too far off the main road. Some were too close to the main road, thus that there might be congestion. So it's a number of factors, again, a delicate balance. Having thought through that list initially, we then started working with county level folks. For example, in York County, one of the first, I think the first group that we called was Director Art Cleaves, the head of York County's Emergency Management Agency, to start getting him in the loop, as well as other officials in and around York County for their local ground level take. So we're not doing this in isolation, but rather doing it deliberately with county level emergency officials who have that ground level truth. I won't go into it more, but other than to note that there are a number of considerations and we're trying to balance them all simultaneously.
Thank you.
Yep, I'm gonna give the final question of the afternoon to Brian Sullivan at WABI.
Thank you, Dr. Shah. Looking at something that Northern Maine Medical Center put out about their public vaccination program, which essentially says went into effect today. It seems like they're starting a line once the vaccination does become available. Is that something that you're working with them on and other hospitals to start a vaccination program so people can get in line, grab a deli ticket for when it does become available?
Short answer, Brian, is yes. Not just at Northern Maine, but other hospitals across the state, some hospitals down east, a couple of other hospitals up in the county have reached out to us and said, we have already started pre-registering folks. We've gotten input from our community. We've got a list going. We're ready to go. Not just Northern Maine, AR Gould has indicated something similar. Other hospitals, I'm at least aware of 2 down east. So we are working with them. We commend them for taking that initiative to start that process. Now we've just got to wait for the right amount of vaccine supply to come in so we can satisfy that demand.
Yeah, and I will just add, not just hospitals, we are also working with some outpatient sites, some other community health centers and other locations, because we do recognize, as the previous question raised, that we need to go outside the boundaries of hospitals as well.
Mm-hmm.
Now, just for instance, someone is a reasonably healthy person and more vaccinations become available. Is making an appointment with your primary care provider, say in August, July, a good idea? That maybe you roll the dice and can get a vaccination if it's available there?
No, we don't recommend that at this point. And I'm going to again go back to, we are trying to do this in an orderly fashion. We ask people to have patience. It's not easy to have patience, but right now we're finishing that 1A category. If you are a healthcare provider, if you are an emergency response person, if you are a person age 70 and older, we're getting ready for you people 70 and older. Come back to check out where you might be able to get a vaccine beginning next week. But I will turn over to Governor Mills because the challenge here is with, again, a limited supply, we're going to have to do this in a patient way.
Yeah, I think that the misunderstanding is, on the part of most people, is that this is like the flu shot. You call your PCP, you say, I want to come in and get my child vaccinated or get myself vaccinated, polio, smallpox, flu, whatever the case may be. And we're used to getting those vaccinations one-on-one. But this is more of a mass vaccination effort, depends an awful lot on logistics and on supply and on getting groups of people together and having them have staggered appointments so that we don't waste a single dose of the vaccine, and that we only thaw it out and use it when there are people available to be vaccinated, hopefully as soon as possible. I think that's the common misconception, that this is something you can just walk into a doctor's office and ask for and get vaccinated. It's logistically a lot more challenging than that. We'll do it. We'll get it done.
Thanks, Brian. And Governor, Brian's question was the last one for the afternoon, so I'll turn things back over to you to round us out, please.
Well, great. Thank you. People have asked on the Zoom call what we're clarifying, what we're doing. And it may sound sort of simple what we're doing, but it's not. And I think of the population of Maine, and I think about the people I know in my hometown of Farmington who are of this age group or with medical conditions that might imperil their lives should they catch the virus. And I worry about people like my neighbors Bob and Jim, who served valiantly in Vietnam, served tours of duty, and fought and suffered, and now are of that age group, and are not only some of the most vulnerable people, but some of the most heroic people in our state are in that age category. We made this decision, I made the decision, along with my wonderful staff and advisors, some of whom are here on this screen, based on medical science and fact, but also based on the conscience of a community like Maine's, which does value life and health more than above anything else. And I consulted not just with them and with medical staff, but with people who understand medical ethics and faith leaders about this kind of decision, because it's not easy. And they all agreed with the public health perspective as well, unanimously. It is about whose life can you save? Who's more likely to die with COVID-19 if they don't get the vaccination, if they don't get the vaccine, and if they're not top of the list? That's the reason we picked this group right now to go to the head of the line, so to speak, although we don't like to think there's a line. But based on the limited supply, we are prioritizing the people who are of an age and of a condition who are most likely to suffer and die if they don't get vaccinated first and foremost. That's the whole fundamental reason for this decision. Not an easy one. There are piles of people, tons of people, who feel strongly and validly, reasonably, that they should be vaccinated for a lot of good reasons. Not everybody can be vaccinated yet. But boy, as I told the Vice President yesterday, if you send it, we will get it done. Send it and we will use it. Whatever you send, we will use, and we will save the lives of many people. Thank you for listening and watching.
Thank you very much, everyone. Have a good afternoon.